Living with a disability may be difficult, and therapy animals have long been known to help people with disabilities feel more supported emotionally and live better lives. Due to conditions like allergies, phobias, or the incapacity to take care of a live animal, some people are unable to benefit from traditional therapy animals. Welcome to the Futuristic AI channel. Subscribe and let's dive into the program real fast. Robotic therapy animals can help in this situation. These robot therapy animals, which are created to appear and feel like actual animals, offer similar advantages to conventional therapy animals while also providing other benefits like no risk of allergies, no need for upkeep, and the possibility to tailor the animal to a person's tastes. The advantages of robotic therapy animals for people with impairments, such as how they can boost independence and social skills while also offering emotional support. We'll also examine some of the most well-liked varieties of robotic therapy animals and how they might be applied in a number of contexts, such as medical facilities, nursing homes, and educational institutions. Herding dogs are known for their comforting and healing qualities for a very long time. Nevertheless, did you know that a plethora of other species are starting to play this crucial role? Nowadays, elderly folks are helped in many therapeutic ways by the company of cats, birds, rabbits, and even robotic animals. Seniors who receive pet therapy can feel better and perform better on the physical, mental, and emotional levels. People's stress levels can be reduced, they can become more active, and they can come out of their shells when they interact with a friendly and affectionate animal. Seniors who struggle with loneliness or who have chronic illnesses like dementia, cancer, or heart disease may find this to be of great assistance. What is pet therapy? The use of animals for therapy and company is referred to generally as pet therapy. Both animal-assisted treatment and animal-assisted activities are included. Despite their apparent resemblance, these two terms are not exactly the same. Animals are used as a therapeutic tool in animal-assisted therapy. It is planned to achieve specific therapeutic objectives and is supervised by a medical practitioner who has a thorough knowledge of how people and animals interact. Each session is recorded by the expert, who also keeps tabs on patient development. An old man suffering from a stroke might be instructed by a physical therapist to brush a dog's coat or throw a ball to a dog as a means to regain the use of his hands. The use of animals for therapy and company is referred to generally as pet therapy. Both animal-assisted treatment and animal-assisted activities are included. Despite their apparent resemblance, these two terms are not exactly the same. Animal-assisted activities, AAA, are more informal and are carried out with no predetermined therapeutic objectives. Normally, properly trained therapy dogs or cats visit hospitals, nursing homes, hospices, and assisted living facilities to comfort and cheer elderly people. Staff members at the facility typically offer some direction and support, but they don't make official notes. The benefits of puppy therapy for elderly. Seniors might gain a variety of benefits from having pets nearby. For example, walking a dog is undoubtedly a good kind of exercise. An elderly person can experience a sense of purpose and need by feeding, grooming, and caring for a pet. Also, the complete acceptance and unconditional affection that animals offer can significantly reduce people's stress levels and aid in diverting their attention from their own difficulties. Indeed, studies such as those published in the Journals of Gerontology Series A, Biological Sciences and Medical Sciences and Current Gerontology and Geriatrics Research confirm the effectiveness of animal-assisted therapy in treating loneliness and depression in senior citizens, and it is becoming more and more common in nursing homes. Consider dementia patients as an example. According to research, having pets can help those who suffer from this ailment feel less agitated and stressed. According to a research published in the Western Journal of Nursing Research, bringing a professionally trained dog into an Alzheimer's care facility significantly reduced the residents' behavioral problems. Also, a different study published in the Western Journal of Nursing Research discovered that when fish aquariums were installed inside the facility for residents to view during meal times, Alzheimer's patients residing in nursing homes received more nourishment and put on more weight. Animal-assisted therapy benefits for seniors can also include increased self-esteem, reduced feelings of anxiety and isolation, decreased blood pressure and heart rate, improved motor skills, increased social interaction, stimulated memory as seniors reminisce about pets they used to have, quicker recovery time from injuries, higher levels of physical activity. According to Dr. Sandra Peterson, DNP, a senior health and wellness consultant with Pegasus Senior Living, robots have a place as companions to humans, especially in conditions like those we have experienced inside the pandemic. The robot can be of enormous comfort to elderly people who are lonely and alone in the absence of human relationships. A robotic baby seal pet reduced the anxiety, stress, and usage of psychotropic and painkillers in elderly dementia patients, according to a study by Peterson published in 2016. 5. She brought a clean robotic seal during the epidemic to communicate with the people being quarantined. The seniors were able to hug and interact in a way that, at that time, we as humans could not, she says. The robot created a safe interaction for the patients. Even those with quite severe cognitive impairment interacted, some did so while holding the device in their hands and sobbing or conversing with the robot about their emotions. Peterson has discovered that few visitors decide not to interact with the artificial pet while they are there. Robotic animals offer special perks. Although it may seem a little sterile to consider replacing a living pet with a robotic one, there are several benefits. To begin with, genuine animals might not be permitted in nursing homes or other care facilities. Taking care of pets can be challenging for those with dementia. They can be too immobile or fail to take care of basic necessities like food, water, and litter box cleaning. They won't have to deal with the emotional effects of a pet dying, says Dr. Amy Doremus, professional psychologist and author of Understanding Bipolar Disorder. They might not be able to get an ill or injured animal to a vet, she adds. The growing comfort with technology, which is now more widely utilized in other areas of health than ever before, is a benefit of robotic pets, according to Schiff. Robotic animal companions haven't been shown to have any negative effects on dementia patients, according to research. But Schiff advises that things may become difficult if a person starts to worry about taking care of the animal and starts to think it's genuine. Robotic dogs may also be beneficial for those who suffer from other chronic disorders, such as autism spectrum disorder. Researchers in 2019 compared the effects of real dogs to those of robotic dogs on children and adults. There was no difference between the two in terms of encouraging social communication behavior in adults. Many people might not have access to or the skills necessary to care for a pet, just like those who have dementia. In spite of the fact that Doremus notes that animal therapy for people with developmental disabilities or chronic mental illness is well established, you still have some of the same problems with making sure the animal is well cared for and figuring out what to do if someone lives in a home where pets aren't allowed. The impacts of robotic pets might be comparable to those of living ones, but without the hurdles. To determine the impact, however, additional research is required. Robotic pets, which are devices created to look and behave like real dogs, cats, or other animals, may seem like a plot device from a science fiction film. Robotic pets, however, may imitate real pets and react to human interaction because of artificial intelligence. For instance, a robotic cat or dog might purr or wag its tail. As technology develops, robot pets resemble living creatures more and more. Real animals are used in animal-assisted therapy, which has many advantages. Real animals, however, might not be permitted in facilities like nursing homes and elder care facilities due to the possibility of allergies, infections, biting, scratching, and people tripping over them and falling. A person with memory issues might not be able to take care of a genuine pet, even in their own home. They might ignore giving it food or water, going outside or cleaning the litter box, giving it too much or too little medication, or not taking care of its veterinary needs. When not in use, a robotic pet can simply be stored. A genuine pet can also outlive the person with memory issues and need to find a new home, so you might worry about that as well. Or the animal could pass away, leaving the owner grieving and alone. For those with disabilities, robotic therapy animals have proven to provide a variety of advantages. They provide company, encourage sociability, lessen stress, and they even support treatment sessions. Robotic therapy animals offer a safe and useful substitute for conventional animal-assisted therapy, and their technological improvements promise to keep enhancing the lives of those in need. Thank you for watching. Follow for more.